This is about helping people and helping people have more quality of life, be able to be active participants in their own life, and have the basic things that all of us want and take for granted.
But Florida ranks 49th in the nation when it comes to caring for people with mental illness, according to a recent study. The Commission on Mental Health and Substance Abuse is supposed to examine state services and make improvements.
The Charlotte County Sheriff was appointed to lead the group. NBC2's Samantha Serban has been digging into this report and the recommendations.
I should be dead 20 times over. I've had guns put to my head, knives held to my throat. I've fallen 20 feet out of trees and bounced up like a squirrel with no issues.
Jonathan Haying has the courage and the faith to share what most wouldn't let leave their lips.
Did a lot of drugs to kind of anesthetize myself from the pain and the guilt and the shame associated with making a lot of poor choices.
For decades, he sold drugs, was in and out of jail, self-medicated, until one day he decided to get help.
That's where these reports come in. This one is from January, where a group of 19 people analyzed our mental health and substance abuse system, focusing on things like access to care, jail diversion, and follow-ups. It's strikingly similar to this report, released over 20 years ago, a fact that made the chairman of the new board question our state leaders.
Realistically, it doesn't look like there's been much changes from one report to the next.
No, and that was one of the frustrating things when I was first appointed to the commission.
Charlotte County Sheriff Bill Promell is extremely passionate about mental health and keeping our community safe, emotionally and physically.
When I just addressed the legislator earlier this year, I kind of told them that same thing, that I was very discouraged in what I found, and that I hope that they don't kick it down the road like other legislatures have.
Among the new board's recommendations, sharing data between departments, diverting mental health cases from the jails, and emphasizing follow-ups and check-ins.
Nobody knows that that person had communication over here, they're being treated over there, they went through this. There's also no follow-up if that person decides suddenly that, no, I don't want it anymore. Just like the shooter at Marjory Stoneman, when he turned 18, he had the option of not going because he was in intense treatment when he was a juvenile. But once he turned 18, he decided he didn't want it anymore, and there was no follow-up and nobody did anything.
That's just one example. When people meet licensed mental health counselor Amy Hood, it's often too late.
One of the biggest pieces to do that is to try and get more in front of the issues. Right?
She says what's needed is continued care, something more preventative in nature than reactionary treatment.
Those types of things are not currently available or funded in any way in the mental health and substance use world.
The David Lawrence Center in Naples says the state Senate is investing $34 million this year into the system, aimed at increasing access to crisis services. In 2021, more than $750 million went out, but that doesn't mean it was all spent.
Like this $61 million that
was returned?
Yeah.
Yeah.
The influx of cash may help the system Dr. David Shern tried to better 2 decades ago. He chaired the Mental Health and Substance Abuse Commission put together by then-Governor Jeb Bush.
And I think that we really do need an infusion of new resources as well when we're so fundamentally underfunded.
Dr. Shern says over the course of his 40 years in this field, there's been an epidemic of mental problems facing our state, especially in kids and teens. As the tone around mental health changes, Shern hopes state leaders will take newer recommendations more seriously.
I have never, in that amount of time, seen mental health so prominently featured in terms of the public conversation.
Because at the end of the day, improving the system will not only help patients like Jonathan.
It's a godsend. It's really, truly a blessing that resources like this exist for people like myself and anybody else out there that might need them,
It keeps you and your family in a better, safer, more productive community, too.
This is about helping people and helping people have more quality of life, be able to be active participants in their own life, and have the basic things that all of us want and take for granted.
Change takes time, but the first order of business is making sure the commission led by Sheriff Promell can continue their work.
Our commission is actually set to sunset on September 1st of this year. So if we don't get the legislation passed that's going through that extends our life for at least till 27, we're kind of dead in the water.
Reporting for NBC2, I'm Samantha Serban.